Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty.
Right, Manuel, tell me what's going on with your IT band.
So I was, a couple of months ago, I was stretching, doing a stretching routine. And during the stretching workout, I didn't feel anything at all. But the next day, I felt pretty painful.
In your IT band and your hamstring area?
Yeah, it was pretty painful.
How much pain did you feel there from 0 to 10?
Around the 9.
9? And what kind of pain did you feel? Sharp, dull, aching?
It was a sharp pain.
Sharp pain. And how long this been going on?
About 8 months.
8 months. Have you had treatment since then?
No.
And what kind of motion aggravate your symptoms now?
When I'm sitting on the floor, like cross-legged, when I'm sitting for a long period of time.
Sitting for a long period of time, you feel pain?
Yeah.
Do you feel pain right now?
No.
Any other symptoms?
No.
So I will have you actually sit on the table, cross-legging, and we'll see, like, we'll test your pain level.
Okay.
Yeah. So how much pain do you feel now?
Maybe like a 3 or
3?
Yeah.
Okay.
I don't feel pain, but I do feel
The tightness, the pulling, and where do you feel it exactly?
in this area.
In that area?
Yeah.
Okay. All right. Anything else aggravated?
No, but when I do start to feel it a lot, I can like feel it a little higher up in the leg.
Okay.
But this is the area where it's mostly felt.
So the IT band and your hamstring. And when that happened, did you have any bruises or anything?
No,
You just overstretch it and you strain your muscles. Okay. So let's do the treatment and then we're gonna retest it again. Okay. And relax. And you feel it right in here
maybe a lower down.
and here.
Yeah, I think so.
Here too?
No.
Huh. Okay, let me know if that's painful, okay? So you were stretching before. What kind of exercise you used to do?
What kind of exercise or stretching exercise?
Or like before you used to, why you were stretching?
Just to get
flexible?
yeah.
You were not
Flexible.
running or any
No.
anything? Okay. Yeah, overstretching actually causes tear in the muscle. It's like, you know, your muscle should be like a rubber band, and if you overstretch it like that, you're gonna cause micro tear, and you couldn't strain.
Yeah.
So that's why overstretching is not.
Yeah.
Yeah.
I didn't think I was overstretching it, but I must think that's what it is.
Yeah. Is it too much here or it's okay?
It's okay. Yeah.
So I'm gonna give you some exercises to do it for tight muscle. That's more effective than stretches.
Okay.
I usually don't do stretches because it's not effective.
Okay.
And there's high chance of injury with the stretching. But your IT band extremely tight here. So let's actually, I will have you line your stomach head here. So we'll have access to your hamstring too. Stomach head here. The other stomach. Yeah, this one.
This way?
Yeah, on the stomach. This one. Okay. Let me know if it's too much, okay? You feel the tightness here?
Yeah.
Okay. Is it painful? It's okay.
It's a little painful.
Sorry.
It's not that painful, but I do feel something.
Okay. If you feel pressure, it's fine. If you feel pain, just make sure you communicate with me.
Okay.
Too much or it's okay?
It's a
Let me see, 1 second, okay? She said yes. No brain injury? No. She said no.
Do you have any issue with your calf here?
No.
Even if it's too much.
Just want to make sure everyone else is still doing this, except for Carol, me, and Melissa. Alright. Thank you.
Okay. So I'm gonna work on breaking the scar tissue. It's gonna feel cold. Make sure it's not painful, okay?
So you do feel like scar tissue? Or?
Yes, there is a scar tissue. Well, so when you strain any muscle, you cause a tear.
Yeah.
It's like a paper cut. When you have a paper cut, the first stage of healing is inflammation, swelling, redness, and the blood starts to rush to that area.
Right.
Bend your knees, both of them. So the second stage is a proliferation stage. That's when the body starts to build the scar tissue to heal. So if our body actually does not build the scar tissue, it's open wound susceptible for infection.
Yeah.
So scar tissue actually very essential for our survival. The same thing happens internally when you strain your muscle. You get a micro tear,
Yeah.
and your body builds the scar tissue. Perfect scenario, actually the last stage of healing is called maturation. That's when the body actually dissolves the scar tissue and everything clears up. But when that does not happen, usually patients stuck in the proliferation, sometimes proliferation and inflammation. So what I'm trying to do is actually to break down this excessive scar tissue, so hopefully we'll transition you to the maturation if you don't have inflammation.
Oh, no, you're going to do the x-rays here.
And I will show you where the scar tissue.
Yeah.
You feel this bumps here?
Yeah.
That's a scar tissue. It should feel like nice and smooth, like, well, you have a scar tissue here too. Let me see if you have a good example. It's a little bit scar tissue, but nice and smooth here. More scar tissue here.
Yeah.
You feel that?
I do.
So when you have a scar tissue, and instead of your muscle act like a rubber band, contract and relax like this,
Yeah.
it's like you have a knot in the rubber band. So when your muscle contract, it
Yeah.
does not stretch.
Good.
And that decreases your range of motion. So when you are trying to cross your legs and try to stretch your IT band this way, it does not, because you have that scar tissue not allowing to stretch.
Okay.
Does that make sense?
Yeah.
So, and that's where you feel that grinding here. Make sure it's not painful. And here, there's a lot of scar tissue too. Feel that?
Yeah.
Like kind of marbles there. And a little bit here. So that's why stretching is actually, it's easy to tear a muscle with the stretching.
Yeah.
So, like here on the portal, it shows that it's still pending.
Is that too much?
No, no.
Okay, do you want to go ahead and speak to Tiffany? Okay.
Feel this one here? It's a big knot. Do you do a lot of sitting? You sit a lot, or you are on your feet?
At work, I try to be on my feet, but there is a lot of something.
Yeah, that's when the IT and the hamstring. So I will give you some exercises for that. Sure. Is that too much?
I don't know.
Okay. And actually, if you look in this area, you will notice the redness where you have the scar tissue.
Yeah.
Look here. So I worked on the entire area, and you see those red spots.
Yeah.
Those actually the location of the scar tissue. The blood starts to rush to that area. So as you work on it, that redness should be disappearing as we break the scar tissue. Can you feel that here?
Okay.
Sorry.
Okay.
Sorry.
Okay, yeah.
Okay, so we clean this up, and I will have you test that range of motion again and tell me you still feel it or it's gone. And you can actually see the redness is very easy. You can
Yeah.
very easily see it. And you see more here too. Okay, so let's actually cross your legs and tell me from 0 to 10 how much is now.
It's a better.
0 to 10.
Yeah.
Do you feel it or it's gone?
I think it's gone. It's gone. Yeah.
It's gone.
I don't feel it as much as I used to.
But so you don't feel it?
I don't think so now.
Okay.
I feel the.
Yeah, the area I worked on. Yeah, that's because you had the pressure on it, but
But I don't think. Yeah.
but you don't feel the pain when you just came on.
Not as much as I used to.
Yeah. So what do you think about the treatment, just ASTR treatment, when you just what we just did for a few minutes?
I think it'll help me.
Yeah. Awesome. Thank you.
Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video within the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.